Hi everyone. My name is Dr. Suresh Chandra. I am a surgical gastroenterologist practicing in Hyderabad, and today we need to discuss about one of the common problem which majority of population is encountering. So this problem, I try to come across this kind of clinical problems very often. That's why I wanted to make it a public awareness program on this day when World Hepatitis is being celebrated. And on this occasion, we will try to know the common things which everyone should know about hepatitis. Why we see there is a increased incidence or tendency of increasing more cases being detected every day and day. So on this day, we need to know what is the cause for this, why this trend is increasing, what we can prevent it, and what precautions to be taken so that it can be avoided before it arises. So hepatitis, it's nothing but it's like infection in our liver. So what causes infection? Usually routine infections which can come through contaminated water or contaminated food. It is called as hepatitis A virus, which is self-limiting in it most of the time. So usually the patient will suffer for a few weeks or maybe 1 month or so, but usually recovery is uneventful and patient will recover. But during that time, patient will have a very long bed rest period. So during that time, he may not be oral intolerance will be less. But that is a routine a seasonal type of hepatitis called as hepatitis A. What is more important for us is the hepatitis B and hepatitis C, which actually forms the basis for this hepatitis day, which we need to understand more. So about hepatitis B and hepatitis C, which is it is a blood-borne infection, because the infection spreads from person to person, either to contact with the blood or transfusion of blood or contact with infected blood or blood products like plasma, frozen plasma, or any products of blood. So that is one way of transmission, and sometimes through sexual contacts also. So it is secretions of the one person which is through which this infection tries to spread. So here the main prevention is avoiding contaminated needles, contaminated blood, and good sexual practices also. So this is the one option where we can avoid this one of the what you call growing hepatitis problems, especially in the developing countries like ours. So in this, after infection also, patient or the person will not have many symptoms initially. It may be remains dormant for years and sometimes for decades. Later, once the liver slowly gets damaged, the patient will develop different stages of destruction of the liver, as we can see here. Initially the liver will be fibrosis will be there, more fibrosis, then it will be completely replaced with fibrous tissue where there is no functioning liver, and it goes into complete failure when more than 90% of the liver gets damaged. That is called as chronic liver disease, or patient going into cirrhosis, called as cirrhosis of the liver, where there are many stages are there, like stage A, stage B, stage C. The stage C, where the patient will be crippled, bedridden, and he needs ultimately the liver transplantation. So nowadays we see that the increased number of cases going for liver transplant because of hepatitis, especially hepatitis B or hepatitis C related diseases. So to curb this, Or to prevent this, as we discussed, prevention is probably the best thing, and that is one thing. And even if patient has come in later stages of the liver disease also, now because of increased knowledge of medical, surgical, sophisticated treatments, the success of liver transplantation has given way for hope for in these debilitated patients. So wherein patient after successful liver transplant can lead almost a routine normal life. So again, this goes with medical treatment as well as a surgical treatment, where a group of team of specialists will be addressing these complex situations even if they come in late stage also. So on this day we need to know that hepatitis is a preventable disease, where having a knowledge of its mode of spread, its various disease its causes, one knows if we can prevent it, and if timely intervention is done, then we can prevent it going to a debilitating and crippling chronic liver disease also. So next time we will try to address another common liver disease called non-alcoholic fatty liver disease in our next session, and until then we on this liver hepatitis day we will say goodbye, and we will come back again. See you, take care.